We're very pleased to welcome folks from the leadership team at Judson. As all of you know so well, our senior communities have been hit hard by COVID. It has taken its toll in senior citizens, both in infection rates as well as the impact of isolation. So we look forward to the information that's going to be shared by the Judson leadership team. Let me first welcome Kendra Urdzik, who is President and CEO, and oversees Judson Park and Judson Manor in the University Circle area, South Franklin Circle in Chagrin Falls, as well as the services provided under Judson Home Care. Kendra has a long career in nonprofits, specifically at Judson, and serving our elderly over almost 20 years. And she, as we've heard from several of our leaders in the past few weeks, began her career as a college intern. So for you young people, take heed that you can begin life as a college intern and stay in the same profession, same organization, work your way to the top. Kendra cares deeply for her residents and values the opportunity to truly listen to what their needs are. She is a proud mother and a proud member of the Leadership Cleveland class of 2020. Like to also welcome, cheers, yes. Also like to welcome Julie Anderson, who serves as Vice President of Judson Manor. Julie, too, brings with her a long and successful career in nonprofit management, having previously served at MoCA and Botanical Gardens in roles of the Chief Operating Officer. He is a proud alum of Leadership Cleveland 2013. And Cindy Strug. Cindy serves as the Vice President of Health Services at Judson. She also serves on the board of Leading Age Ohio, where her voice can be heard in advocating for our senior citizens. Thank you very much for making time in your busy days to join us. And with that, I'll turn it over to Kendra.
And thank you everyone for being here to hear about Judson today and the past 3 months of how things have changed drastically for our residents, families, and for our leadership team throughout this period of time. And thank you again for having us, Mary Ann and Bob and the team. It's so good to have a voice in all of this, as we've been really publicized out there just about how long-term care and aging services has struggled through this, this pandemic most recently. But I just want to get started by giving a little bit of background about Judson. As Mary Ann had mentioned, we do have 3 physical bricks and mortar campuses, 2 in University Circle, which is Judson Manor, and then obviously our Judson Park campus right here in Cleveland Heights, as well as our Chagrin Falls campus. So we have been established since 1906, serving older adults with our mission of bringing community to life. And our services that we offer vary anywhere from independent living, assisted living, and then nursing care. We also have a hospice program, a Judson Home Care program, and our Judson at Home, which was our virtual campus without walls, serving over 700 residents, both on our campuses and in the greater community. And then we also have about 500 associates who work on our campuses and through our Judson at Home program as well. So just to give you a little bit of background of what we do and who we serve. But just to, get right to it, because we have a lot of information to share. This 3 months, we kind of put a timeline together actually for our board the other day, and to give them an understanding of, where this all started. This industry, nursing homes and assisted living, is one of the most highly regulated industries out there. And so when COVID came along, it really shifted everything we do and how we do it and the guidance around that. We've been working specifically with the Centers for Disease Control, and you'll see here some of our local health departments, both the Cuyahoga County and the City of Cleveland health departments. And every time something shifted and changed from all of those different entities, we had to shift and adjust as well. But I think, the thing you'll hear from us today is not just, how we operationalize things and how we managed COVID, but how we brought community to life on our campuses, because that's what we do every day, and our residents live here for the connectedness and the programs and the opportunities, as well as the care model. But that changed so drastically for our residents just over these last 3 months as some of those regulations were put into place, and as well as for our associates. So when we look at, March, we started back in March on March 13th, and we had to immediately close our assisted living doors and our nursing care to families and anyone coming in to visit friends, what have you. And so that was very traumatic. We called all families and notified everyone directly right away from the beginning, personal phone calls letting them know what would be happening once there was the imminence of COVID coming into our campuses. And we had to really deploy things pretty quickly through education to our associates, families, and residents. Shortly after we closed, from a regulatory standpoint, both assisted living and nursing care, we really knew it was the right thing to do to say, even to our independent living residents, which is the majority of our campuses, is that we were going to have to take a step back and also close our doors on our campuses for independent living, no longer allowing individuals to come into the community from, again, families and visitors, as well as not allowing residents to go out unless it was medical appointments, which is not our community whatsoever. People are very active and engaged in the greater community, but we recognized, from a global perspective, that because we have congregate living, we had to really adjust to that and recognize that this could spread very rapidly, especially within our population that's the most vulnerable population, to have the greatest repercussions from it. And that was a really difficult decision. We were really out at the forefront of that and talking with all of our partners, both from across the country and nearby, just in northeastern Ohio, that we all needed to make that change, but we made it, fairly early, and thus we've not had COVID on 2 of our campuses, which I think was just extremely important. And then, something we had to do is create a COVID area. We knew from the beginning, at some point, we may have exposure coming into our campuses. And so how are we going to handle that right from the get-go? We had to think about that throughout, and Cindy's going to talk a little bit more about the clinical aspect of that. But one of the ways that we did that was closing off in our nursing center an area and making it a designated COVID area, just for those individuals who had any symptoms, whether fever, cough, respiratory, anything, right away, so we can isolate any issues that were happening. And then we also created, and shortly thereafter in April, a COVID step-down area to be able to transition people who, if they were exposed or had COVID, off of that area into a step-down area that, again, was isolated just for those individuals. And, I'll just give you a little bit of background. We had our first case back on April 6th from an associate, and then a resident case thereafter. But so much of what we were doing right from the beginning is educating our associates on, once we close our doors, our exposure is going to be coming from the people who are bringing it into the campus. And so we needed everyone to be thinking about it from the get-go of, what am I doing outside of work? What is my exposure level, and just making sure that they understood PPE coming into the campuses. Again, this greatest population for exposure, and how every single move that you make can affect our residents on our campuses. So soon after we had those cases, that we did a lot of phone calls with the city health department, as well as the Ohio Department of Health, just to wrap our arms around, okay, what do we do next? How do we continue to manage, now that we have cases coming into our campus, how do we then wrap our arms around this and ensure that it doesn't spread? Because you've heard, everyone has heard how quickly COVID could spread amongst senior living facilities. And so we really wanted and reached out continuously to be in front of that. And in May, you can see here that, obviously we've continued to talk with the health departments. We did have one small exposure that we had to wrap our arms around, and working again with both Cuyahoga and the city of Cleveland. We worked with their epidemiologist, and in general, their medical directors as well, which was very helpful throughout. And then we worked directly, we were each assigned a University Hospitals was our partner, but a hospital partnership to help guide us and through testing and so forth, and just to be our eyes and ears and provide us with testing, as well as some PPE if necessary, and just to be a partner throughout. We did have a greater testing of a group because we had a spike. Obviously here in June, you can see. And so what we did is we completely tested a floor and all associates working in that area with very limited results of positive, but it was good to do, as good measure for us to look at that as a possible cluster, and just to kind of see what we could do next. And again, to limit the greater exposure. So that intercept team at University Hospitals was instrumental in that. And since that time period of that mass testing, which was an undertaking in itself, we've had some very good results thereafter. But what we came to find out is that, as you heard, many of you have heard, is this kind of those people who do not have any symptoms, those asymptomatic carriers. And we recognized we had a few of those individuals who had no signs or symptoms, but still tested positive and could be sharing the virus with others. I'm going to turn it over to Cindy just to talk a little bit about, what we did for the pandemic management of this 3 months, which focused a lot around communication. It really, and I'll let Cindy here take over, but communication was everything throughout this process at all levels, families, our residents, our associates. But I'll have her talk a little bit, speak to, what we did to ensure we had clear communication throughout.
So I think, it's interesting because while it's a perfect storm for, infection disease and really trying to manage it from that clinical side, the human component was so significant and you need to really bring that team together. So, we did both daily leadership and clinical management calls. So kind of getting everybody across all of our campuses, on board with what was happening, because again, as this evolved, things changed rather dramatically. So what we knew day one and what we know now 3 months into this is very different. We found very early on communicating with families was very important, and we had kind of special emphasis on the units that were more affected. So we have a memory care unit at Judson, and that seemed to be the unit that had most of the infections, and it makes a lot of sense why it's a very difficult group of residents to isolate. Certainly it's a group of residents, you can't necessarily put a mask on somebody with dementia. They don't really understand that. Trying to get people to, maybe residents, to wash their hands more frequently, it's very difficult. So, many times by the time we identified one resident, another resident may have been exposed. So, communicating with families daily in terms of what was going on, but also in terms of what we knew about exposure, prevention, and really trying to work through that. Additionally, if you've talked to any of, the health providers, everybody had a very challenging time ever doing telehealth visits. In the period of, say February to now, you'll talk to most of the health systems, their telehealth went from like 0 to 83% of their, interactive with patients and, with our residents being telehealth. And that was a really great way to also help our residents clinically, because the nurse was right there with the virtual visit with the physician or advanced practice provider. So we were really able to do much more work virtually, and something that we tried to do for years happened in a month. So it's interesting how that worked, and we see a lot of benefit to that going forward. We instituted a call line where all of our families could call, a lot of work with our employees, simultaneously while our residents were having challenges and couldn't see their families, our own staff were having a lot of the same issues. So, we're trying to kind of move all of us together at the same time in terms of what's going on, keeping everybody informed. And, very early on in this, there was a lot of fear. So staff didn't maybe want to come to work, right when we had our first case. Lots of education, lots of making sure people understood sort of how the infections occurred and what we were doing to prevent. So you can see that that's where we kind of moved into a lot of infection control and surveillance. So one of the problems with our industry is it's very difficult to staff. And there's always a shortage on a good day. We're probably running maybe about 20% short. When things like this happens, it becomes very challenging. So we wanted to make sure our staff came to work, because that's very important. We wanted to really minimize staff going across campuses, across units, and we particularly tried very, very hard to limit agency use. And again, that's those temporary employees who come for a day, but we knew that across, the community, there was COVID in different agencies. And the more we had persons that we didn't know coming into our campuses and didn't know what their exposure was, the higher our risk was. So we began doing twice daily screening for our associates. So once they came into the building and once they left, so we could look for any kind of symptoms and really try to prevent any exposure. And then also we were screening our residents. And, you know, while you hear on the media, you know, temperature, cough, those kind of things, and, you know, everybody's in tune to that, we learned early on with a lot of our seniors, the symptoms were very different. So much more kind of GI and stomach issues, maybe person's activities changed, maybe somebody with dementia had some different behavior. So our staff really had to be in tune with those particular residents and just looking for subtle changes. It kind of wasn't as black and white as you were hearing. And then, you know, working through, once we identified somebody or a resident with some of those symptoms, we had to also be careful because everybody went COVID, you know, so meaning that as soon as someone had some subtle changes in their health, it doesn't always mean it's COVID. So we had to kind of gently balance, you know, were these symptoms of COVID and should we test, or was there something else going on? So, you know, that was kind of a hard part in, I think, just getting everyone to sort of look at the world not always as COVID, I guess. I'll let you go on to the next slide, Kendra.
I see, oh, thank you, Bob. Unmute, yes. You know, as we talk about communication and, you know, our associates being fearful, you know, when you hear those instances where nobody comes to work because they are so fearful of what's next and could I get this? And, you know, again, a lot of education, but what we did is our hallmark has been transparent communication throughout. From both our website, everything has very much been out there in any cases we've had, what we're doing, how we're communicating. This is just our website right here. So families or anyone who was interested in what was happening with Judson, they could log on immediately and would get the COVID-19 updates, talk about our response measures and any other information that they needed. With all of our daily updates, it would go out. And then people could sign up online to, it's all still up online, receive all of our daily updates on what's happening. So they felt connected to the community, even if they couldn't be connected to their loved one or to, you know, obviously to help administration as well with these updates. It was good to have this both online. And then we also had a daily update that went out to, this is a little bit blurry, but to just give you a sense, every single day we send a communication out to our residents and families. So everybody has a sense of how many, you know, cases do we have. We, as Cindy mentioned, we put the call line into place so anybody can call with any non-clinical questions. Or to reach out to someone. We wanted to have open communication throughout so no one was feeling like they were left out of the loop. We always had frequently asked questions as we had to kind of re-operationalize our whole business and become a self-sustaining community with grocery shopping and everything else we did for our residents since they weren't allowed to leave, and virtual visits and putting everything in-house. You know, there's a lot of questions. How do I handle this? How do I do this? So we started some frequently asked questions as part of the communication. And then the residents also were very much engaged with these helpful hints of the day, just to share a little bit of, you know, how they're dealing with it in some ways that they can express themselves. I'm going to turn it back over to Cindy just for some more pandemic management of the education and partner relationships.
Yeah, so I think there was a little bit of a question too, how we had our daily clinical calls and daily leadership. So we had just a call line that we would use at a certain time each day, had a quick agenda of kind of running through on the clinical side what was happening with our residents, as well as, you know, any new questions, kind of guidance, and then more on the leadership side, a little bit more sort of operational issues and how things were going from campus to campus, and, you know, maybe where we could share some of those resources. It actually, I thought, you know, was a really good way, I think, to bring people a little bit more together. Sometimes our campuses run a little bit more in siloed. So this was a time to really see how, one sort of situation, worked across our campuses. And it actually, I think, created some more bridges and persons working together. So all of these things seem to have their own kind of side effects that were very, very positive, even though we were going through a pandemic. A lot of, pandemic management stems from the fact that you do some emergency preparedness planning, and you think, well, will I ever use it? Probably not. But of course, in the fall, we did do an infectious disease pandemic that was simulated across a lot of community agencies and hospitals. And so much of that regional testing and planning really went into effect. And so Cuyahoga County has a very solid and incredible emergency preparedness, cohesion. So there's always persons available on a daily basis, a lot of communication that goes out. And so if you kind of miss something on your own, you're really tuned into what's happening and how things are changing. Lots of training for our residents and associates. Things change a lot over time. So what we knew very early on in the pandemic, for example, we thought that persons who were asymptomatic but tested positive were the persons causing all of the disease. And, later on, we find out that's really a very small percentage of persons. So, persons who are asymptomatic maybe at the tail end of the disease, maybe at the beginning, or just actually people test positive for quite a long time, even after they've been exposed, but are no longer infectious. So lots of learning happened, ongoing through the process. And then certainly with the state of Ohio, they were very forethoughtful in aligning many healthcare facilities or community agencies with a hospital for guidance. So University Hospital was our guidance partner. And so ongoing, we can, reach out to them for if we have concerns, and we did have some calls with their team and our team. And then, again, looking to other facilities that are like us. So we have a lot of calls with other congregate living facilities in our region. I know I'm on the board of Leading Age, so looking at, how Ohio's managing that. And then also even doing some advocacy, because again, what was very difficult, I think, throughout this process is there were a lot of governor mandates and directives, and then things got lifted with not a lot of guidance on how to do that. And so families, our staff, others, all had sort of different understanding of, what visiting meant, what maybe now as we're lifting things outside visiting. So really trying to kind of take some of that information and making it a little bit more common across our facilities, which has been very helpful. And again, as persons went through different things, if we had a case, we might have been able to share our guidance. And again, if they had done something, they could share there. So a lot of very collaborative work. Again, this is unprecedented for any one of us. I don't think any one of us have been through quite something like this. And so I think the involving nature of it, and now knowing we probably have another, year before we have a vaccine, how do we take what has been a very sort of abnormal and very challenging process, but now turn it into a more manageable process and get us back to a more normal life and allow our residents, to re-engage and, to have some normalcy in their daily life. So it's been quite a challenge of keeping that sort of clinical surveillance, as I like to call it, but then really allowing persons, back into the world, because you can't live isolated like this. So it's kind of been the challenge. Okay.
Okay, and so, as Cindy was mentioning, there was always this balancing act between our residents and keeping them safe, and then their own autonomy of making some decisions and so forth. But while this time when we were really in this kind of isolated world on our campuses, our goal was to bring community to life for our residents, our mission. And so there's many things that took place, including these virtual visits. This is actually a picture of a granddaughter communicating with her mom in the background to her grandmother, her 97-year-old grandmother, through a virtual visit. And it just brought smiles all around. And that's how we had to communicate with families, is we bought iPads and all types of devices to be able to communicate so people can stay in touch with their loved ones through technology, and a lot of support through us. And we had daily virtual visits available for our residents, and setting that up with all different family members and working with our team. One of the things that we also came up with is a hallway holler for all of our residents. So you think about when you have congregate living, and so we asked people to step out at 7 o'clock in an evening and just to say hello to your neighbors and wave from a distance and chat in the hallway. It's another way to stay connected and create a fun little event. So we also had a resident associate tip of the day. You'll see that in just a minute. There's some funny ones there. So they created that each day. Our residents would submit something just to keep the rest of their neighbors and friends across all 700 residents engaged, from bird watching online to a Cleveland Orchestra event that they could watch online to just a funny tip or other little ways that they could stay connected to the greater community and to our own communities. And we also had a collaboration with the Cleveland Children's Museum and other LC 2020 reach out, and it was fabulous. They were sending cards and notes and just to our residents at all 3 campuses, and it was a great way to connect that way, as well as with the Girl Scouts. And then Tracy Lynn, former Dean of Trinity Cathedral, was also, who's on our board, was doing friendly check-ins and helping out with some of our residents who were doing friendly calls. So at some of our campuses, the neighbors would call each other, just checking in. Since I can't see you in person, I'd love just to see how you're doing, handling the isolation. And then Tracy was always there making phone calls and also acting as spiritual guidance for those people who needed that during that time, because obviously you can't get out to church, and if virtually that doesn't work for you, it was nice to have those kinds of connections as well. And then again, families with their virtual visits, we're just starting today in-person distancing visits, so that's sitting out one-on-one on a patio 6 feet away, masks on, but being able for our loved ones in assisted living to be able to connect with their loved one at a picnic table. And with a staff person there to help with that facilitation is just fantastic, and we're so excited about that today to have those. Daily phone calls and communications, as I mentioned, we were continuously keeping in contact both from an associate standpoint and resident standpoint, and making sure we were being completely transparent and reaching out to the neighborhoods that had some COVID cases, so those families knew exactly what was happening every day and they felt very much in the know. And then you can see this is a picture of our South Franklin Circle Family Parade, which it could not have been a more beautiful day for the families to come around. They hadn't seen their loved ones in 6 weeks, I think almost 8 weeks at that point. And it was nice to have them cruise by, honking, balloons, waving to their loved ones on the sidewalk. There was not a dry eye in the house. You can imagine not seeing your loved one for that long if you don't have someone who's living in a congregate facility like ours or aging services. It was just a fantastic event. And then with our associates, it was the big thing is, they weren't able to leave and go to pick up a meal or what have you. So we wanted to really appreciate them and take that off their plate of thinking about, do I have to bring my lunch? I have enough going on in my personal life. It's hard enough to come to work when there's always the threat of COVID, and I could be, bringing something home to my family. So we really wanted to provide meals to all of our associates, all 3 campuses each day. There were snacks, there still are throughout. And then we've given monetary gifts as well, just to help during this very difficult time. Many people who've had multiple jobs are not necessarily working all those multiple jobs right now because of that threat of COVID, or they may have been laid off, or their family member have been maybe laid off as well. And so we wanted to support them. But our residents, there will be a letter actually going out to all of our residents tomorrow. They wanted to create a grateful resident and family campaign to support them. We have a holiday gift fund here at the end of each year for our residents to say thank you, because there is no tipping in our world of not-for-profit retirement community. It's not permitted, but this is the way that the residents give back each year, and they wanted to do something special throughout this time period. So they're starting their own campaign in collaboration with our Judson Foundation as well. And then our Judson Strong communications, we had, when we did one of our most recent monetary gifts, we did Judson Strong t-shirts, just to, say how much the team has been coming together and working even stronger together over this time period. People you depended on before, you even depended on so much more, both for, the spiritual support around you and, obviously just the little things that we all need, and the support, and the team was so strong throughout. And our communications, I send out a daily, we have the daily communication, I send out a weekly communication to the whole group, just in praise and thanks of what's occurred in that week. And again, EAP, employee assistance programming, has been very helpful. There's just been so much need for that during this time period, and through our HR department as well. So we wanted to make sure that our associates felt like this is a time that they could feel supported more than ever, and they need that. And then, we've even helped some of our associates with virtual medical appointments, not just our residents, so that they could connect with their own physicians if they were ill, rather than going and exposing themselves. So we spent a lot of bringing community to life. The residents and our associates became even closer during this time period, because sometimes that's all the residents saw was our associates, and they really stepped up, to spend a little extra time and to be there for our residents when they didn't have their families or anyone else around. So it was very instrumental during that time period. So here's a little collage of some of the things that were happening at Judson. Up in the upper left-hand corner, you can see these are from our children's museum, some of the artwork. And we also had our art therapist was working directly with residents one-on-one, just to help them with some outlets. You can see in the upper right-hand corner, this is one of our residents who wanted to express herself through art of COVID, and that was her COVID picture with some sunshine. There's some light at the end of the tunnel, and how she can, express that in another form. And then just recently we had 2 members of the Cleveland Orchestra come out in addition, and have a little concert in the front of the Manor, all socially distanced, as well as you can see the virtual visit in the right-hand corner. And I loved the service announcements. You can see in the right-hand bottom corner, the hostess gift. These are our residents coming up with fun ways on what hostess gifts look like before and after. A little bottle of wine, and then the 6-foot distancing. And it's great to have a little humor throughout. And then the helpful hint, I don't know, it's a little blurry, but just want to make sure everybody can read it. Every few days, try on your jeans just to see if they fit. Pajamas will have you believe all is well in the kingdom. And so that was a resident who shared that with us, and we thought it would be great to share with the rest of all of our residents as well, who were obviously isolated in their apartments and homes, but connecting in other ways. Oh, I'm not able to flip my screen. 1 second. There we go. Now Julie is going to actually take over and talk about, obviously with us bringing community to life, and how are we returning to some normalcy. Julie.
So as we're now into this work, 3 months since really our initial closing of assisted living and then independent living, and really this whole time meeting every day with our senior team and the rest of our associates on keeping our eye on the prize, and how do we keep everybody safe now, how do we rework things logistically, operationally, and then also keeping focus on where do we go, how do we roll out, and eventually get back to what will be our new normal. So early on with step 1, which was actually a couple months into pandemic and the lockdown here, we started with figuring out some ways to do some small group activities. Each campus is set up differently, so although we were all trying to follow sort of the same protocols, and that how we got to some of these activities were a little bit different. Here at the Manor, we are a smaller community of about 100 residents, which sometimes can make it a little bit easier to put some of these programs into place. But just early on, as an example, bringing up, setting up a ping pong table in the ballroom with rubber gloves and disinfectant in that, and as we talked about the hallway holler, and we also had some of our Cleveland Institute of Music artists that would come and do concerts on each floor and those kind of activities. I think probably 4 to 6 weeks into this, you would sort of notice a lot of our independent living residents, while they were following what they needed to do, it had now been 6 weeks since they had seen family, and you definitely noticed a change in many of them cognitively and depression, and you would see it a little bit even with staff. So I think all of us really sort of changed our roles. I think Cindy had mentioned before that she really became more of a counselor, but really needing to be there for each other, needing, everybody to communicate what they were seeing about residents, and through this, and you become a big focus as we start to reopen, is the importance of how can we safely get them back with family members. We were doing Skype and phone calls and that. As you look at step 2, where it had it June 1st to June 14th, we were able on June 1st to allow our independent living residents to leave the campus, which was great, and actually surprisingly a lot of them weren't that comfortable leaving, but those that did really just wanted to get in their car and drive, and be able to go and visit a family member. Some of the wellness programs that we were able to put back into place, that was truly helpful. You would notice a change in folks that, because their exercise routine had changed in that, and they're weaker, so their comeback is going to probably take a little bit longer than it might with some other folks. Opening up the hair salon was a very big deal here at Judson, and a lot of other places too, I know. So it's as I said, they've been great at sort of following the rules. We're trying to reopen what we can safely with the protocols in place. The following week, we opened up slowly here our dining room, and the dining room, which is a big social part of living here at the Manor. So probably the one time a day when you knew you would see some of your neighbors. So opening up the dining room was a big help for our residents. We had to reconfigure the whole dining room. We changed to a couple of seatings. All of the CDC protocol and those kinds of things that you have to do were in place, but it was really nice to see the residents back down, and they were thrilled to be back down and conversing with their residents and neighbors and that. As we start our third step today, June 15th, in addition to that, some of the things that we had in place, for instance, we had staff members here that were redeployed into different roles, one of which was grocery shopping and runs to the drugstore. So our residents could put in an order, and their groceries would be here in the next day or so. And while there is Instacart and all those out there, that's challenging for a lot of our residents to be able to manage that on their own. So, working, I will say our residents have really gotten pretty good at Zoom, Skype, and starting to figure out Instacart. And we continue to help them with that, because even though they're allowed to leave the campus, and that's permitted, we obviously ask them to not be going to the grocery store every other day, and that, and to remain safe and smart about the decisions you make. We do not have anything set up for step 4, a date yet for that. We are allowing, this week is the first week that our assisted living residents can have guests. Now, our assisted living has been on their floor, on their unit, since March 9th. All their meals are there, programming. So this is a big deal. They have not really seen anybody other than the nursing staff and dining staff on that floor. So they are permitted to have visits from family members now, one at a time. We're fortunate here at the Manor that our assisted living floor has an outside patio, so that makes it very doable. Out at South Franklin, easy access for that. And then several of our units at the park also have their own outdoor space. So I know that the assisted living residents and really their family members are just thrilled to be able to come back and see their loved ones. So Cindy and Kendra both touched on really what this has done to staff as well as our residents and the family members. And as I said, you do see a change, and the needs that they've had have been greater. And you know, hopefully as things get somewhat back to normal, they'll start to come out of a lot of this. But some of it is something that I think is just a permanent condition, and we have to work through, and it'll be long-term changes for folks. I will say we have an awesome team here, and everybody with different expertise, and we've worked well together, and I think really brought some great ideas and some innovative ways to keep everybody not just safe, but happy and as normal as we possibly can. So we are fortunate for that.
Thank you, Julie. And you know, that's the thing, is at the end of the day, you know, we are Judson Strong. We've had a great team come together, both from our residents and our associates, everybody working towards a common goal while we're keeping everybody safe. At the end of the day, we're back to beginning to bring community back to life here in new ways. And I know we're running over on time, but just wanted, I know, Bob, you're going to be turning it over for questions, right?
I am. Thank you. I was shocked to look down at the time and see how fast it went. So much great information, and thank you for sharing that. So we're going to go over by about 5 minutes. So appreciate if you're able to stay on, everyone. That would be great. But we want to get to some of the questions here. And so, Kendra, just on the real practical end of things, there was a question about the dining rooms. I think you answered that, but just, you know, nationally, you heard about some information about PPE and access to that, and you know, in what ways has that or hasn't that impacted your staff in terms of their ability to safely interact with the residents, and you know, what is the if any kind of the financial impact from COVID on your operations?
Mm-hmm, mm-hmm. So when it comes to PPM, let Cindy jump in from a clinical perspective as well. You know, the guidance has changed throughout this whole entire process, and gaining, you know, ample PPE has been challenging at times, more so at the beginning, not so as much now. But I have to say, coming together as a not-for-profit group here in Northeastern Ohio, we've been purchasing together, group purchasing. We've been sharing. Somebody's running low on gowns. You know, we're driving over to somebody else's campus and distributing them there. So we've had a great network here. All in all, we've been able to obtain. It can be challenging at times, and thank goodness it's kind of, right now we can gain what we need. We do have those PPP loans in place as well to help with some of that support. But, you know, as the guidelines changed, that was probably one of the most challenging, is constantly keeping up with whether it's medical masks, N95s, cloth masks, and knowing what to use when and how much do we need and how do we deploy those, as well as sometimes the shortages. And I don't know if you have anything else to add, Cindy, there from that front. Oh, maybe not.
Maybe not.
Okay.
Has there been, what has the feedback loop looked like? So you're obviously getting direction from the public health officials and from the governor, and there's some interpretation, especially as guidelines have been lifted. Are they seeking input from you, the providers, especially a place like Judson that has managed this so well in terms of the number of infections and how that has operated?
We have had multiple phone calls with them, and especially Leading Age is our voice from a not-for-profit standpoint, that we've had calls specifically Leading Age, and then they're sharing that, but we have been on with the Ohio Department of Health and the governor's team of individuals asking us, you know, insights from our perspective. You know, as we have this mass testing coming out for nursing homes specifically, which has been, we're learning from their processes, they were learning from us, how do they go about doing this, how can we help with some of the conversations around that, how they come in, the National Guard and how is that all going to kind of roll out. They were all ears on a recent phone call just about a week and a half ago. And Cindy, jump in from a leading age board perspective if you have other.
Yeah, I mean, I think it's been really difficult because like all regulations, they all go out and you are always trying to figure out, how to make them work. So I think trying to get feedback about, what's sort of practical ongoing and what's critically necessary. And I mean, I just laughed like 10 minutes before this call. The Ohio Department of Health is doing virtual surveys for our skilled nursing area on infection control and surveillance. So, they just sent about 12 pages of things that they need. So, I think it's been really difficult while you're trying to help, keep your residents and staff safe. It's like almost every day there's a new regulation. So I think, trying to give them some of that guidance of how to make this a little bit more comprehensive and more straightforward, because honestly, what you're doing for COVID is nothing that you wouldn't do for any wide scale infection, but it's like taking a life of its own on, and so I think it's been the struggle of that.
And I think also, Bob, the one big question that why can't we just mass test everybody? And it's just not feasible. The swabs, even through our partnerships and what have you, are just not available in that regard. When we did ask for some mass testing recently, our university hospital partnership said, we just redeployed many swabs out to the National Guard to do this nursing home testing. So we knew we needed to look at that. And then at that point, there still weren't enough swabs. So throughout this process, I mean, I think a lot of people are hearing families and our residents are saying, why can't you test everybody? And it's still, those capabilities are still not available throughout, based on our relationships and how the government has set it up with DeWine's office and so forth.
Great, thanks. The you referenced technology in terms of having to shift and offer things virtually. That you purchased some iPads availability. What other changes have been have you had to make via infrastructure or training, or your residents mostly on board, and that's just been just a shift in how you're offering things?
Mm-hmm. Cindy, I'll let you jump in on that one.
I think we had technology. I mean, to me, the greatest example of this is, to do physician visits. We've always had technology to do them telehealth wise, and I mean, no one could get them launched in, health systems for many, many years, and all of a sudden, in a short period of time, we've done incredible work, not only with one-on-one health visits, but even, bringing a team of specialists together in terms of a resident's needs. So I think an incredible way people have figured out still to do that team-based approach, still provide care, but all via technology. So it's some great tools that hopefully we'll be able to continue to use, because one of the challenges we've had with residents too, when they've gone to doctor's visits, the information doesn't come back very clearly. Sometimes it's very overwhelming for any of us to get clinical information. It's always good to have a partner with you. And so having, the nurse right there with a virtual visit or another staff member has actually helped the care. I mean, we're really to be able to be a partner. So things, I think where technology has actually, facilitated some stronger relationships that way. And I think residents have enjoyed us being there for a lot of that communication. So,
and from a sales perspective too, we're going to be now doing more virtual visits, something that people always wanted to come see where they're going to be living in person, especially our age cohort. And now we are going to be having virtual visits online with a sales counselor. You can either come in or you can do it virtually, which is really kind of cool since we hadn't really gone down that path before. It's just new technology, and people's understanding of technology has grown throughout this. So to be able to offer that, I think it's going to be hugely impactful as we move forward.
That's great. Thanks. Well, in Leadership Cleveland, we've talked about, the difference between managing through a crisis and leading beyond it. And you've given many examples of how you're leading beyond this situation and meeting and, in fact, exceeding some of the needs of your residents. So thank you, Julie, Cindy, and Kendra. Really appreciate all the information and your time. I'm going to turn it back over to Mary Ann, who can close us out.
Thanks so much, Bob. And thanks to the three of you for your honesty and all the great information that you shared. I know there are many more questions that we didn't get to. I'm sure we could spend a lot more time discussing this, but we're grateful for all that you're doing for our seniors here in Greater Cleveland.